Dr. Grace Bachman. I'm the Medical Director for Sonotech Medical Center, and I'm a public health practitioner.
I'm Dr. Jefferson Owusu-Adai, a specialist surgeon currently doing a fellowship in trauma and orthopedics at the Korle Bu Teaching Hospital.
So welcome to another episode of Ask Your Doctor, and as usual, this is brought to you by Jomo Baby and Sonotech Medical Center. In the previous episodes, we've looked at the journey of motherhood. We've looked at all the way from preconception to when a woman is pregnant. One of the important things we want to focus on now is what we are increasingly seeing, cancers amongst women. And the data shows that breast cancer, ovarian cancer, cervical cancer, they are increasingly becoming common. So in this particular episode, I'm really excited to have Dr. Jefferson here with us. We'll take a look at breast cancer. That's one of the commonest cancers amongst our women that we're seeing here. So, Dr. Jefferson, good to see you.
Good to see you too.
Thank you so much for making time. I know how busy you are. Surgeons, people are always cutting, So thank you for making time today. Yeah. So let's spend some few minutes to talk about breast cancer. I know there's something we are always talking about, encouraging women to get screened and all. Over the years, do you think there's been any changes at all when it comes to breast cancer and how women are taking some of these screening opportunities? Have we seen any changes?
Yes, I think there's been a very impressive increase in the awareness, and thanks to the public health professionals who are doing the awareness. So you now have more people voluntarily coming to the hospital, especially in October, which is the breast cancer month, coming to hospitals, coming for screenings. You have more women presenting to the hospital whenever they see anything abnormal with regards to their breasts, and then in line with breast cancer. And generally, I think is a trend that we see whenever there is increased awareness in any condition. You have more people responding, and I think so far it's been good, even though there's more work to be done. But I think the publicity has been good so far.
So do you think that we are seeing more cases because of the increased education, or are these cases that probably would have missed, or is it just that breast cancer has become more common? Which is which? Is it that breast cancer has become more common, or because of the increased awareness now we are actually diagnosing, more?
I think it's more of the awareness.
Okay.
I think the incidents wouldn't have changed much in our population, but people are much more aware now, and so they present, and so we get the cases compared to before when people didn't know about it and gave so many reasons for those conditions, and so we're not reporting to the hospitals.
Okay. So now let's go to the basics again, like breast cancer. For the people who are watching us now, like what's the basic way to explain to them?
So probably we start with explaining a cancer. So basically, when God created us, our body is made up of organs which are made up of cells. Yeah. And then the cells, God has instructed them as to how big they can grow, how much they can multiply to. And He's put, let's say, police officers in charge to make sure that if you're becoming too big, they will tell you to probably stop eating so that you don't become too big. Or if you are multiplying, in case of multiplying too much, they'll tell you that, okay, you're multiplying too much. But sometimes, most of the time, we don't know what happens. You get some of these police people, or what you call checkpoints, that God has put in place so that the cells grow within their instructed limits. We have them malfunctioning, and some of the cells, let's say, they become stubborn, so they begin to grow more than they are supposed to, or they begin to multiply more than they are supposed to. Then we say you have a cancer. And so that can happen in the breast, which is made up of cells, and we say you have a breast cancer. Or it can happen maybe in the cervix, and we say, okay, you have a cervical cancer. Or it can happen in the brain, and you have a cancer of the brain. Or in males, it can happen in your prostate, and we say you have a prostate cancer. So that's the basic concept.
When it comes to in the breast, then it's a breast cancer. Okay. over the years, I mean, what are some of the like risk factors? What puts one woman at risk and not puts the other woman at risk?
So great, a few of them. Basically, to have breast cancer, you need to have breasts, and then females or women have more breasts compared to men. So being a woman puts you at an increased rate of getting breast cancer if you compare to a man. It doesn't mean men don't get breast cancer. I have a few cases, about 1% of breast cancer cases being reported in men. So being a woman puts you at an increased risk. And basically it's hormonal. So we know the breast cells are controlled by estrogen. Estrogen is the hormone that makes a woman a woman. So if you, as a woman, if you don't have estrogen, you eventually look like a man. And so estrogen is what is important, and the breast cells rely on estrogen, so that when there is more estrogen, the breast cells, they multiply more, and the probability that one of them will become stubborn and become bigger is higher. And so a few things that can make this happen. Number one, if you start menstruating early, so then normally you expect women or children to start menstruating around 12 years. And so people who menstruate early, basically when you menstruate early, it means that once you start menstruating, you have excess estrogen. And so it means that the breast cells, there will be a longer period when your breast cells will have access to estrogen. And so it's like the fuel for the breast cells.
Early menstruation, we're talking about less than
12 years. Yes. And then late menopause. So usually after about 45, around 45 years, you're supposed to be hitting menopause. So people who have menopause beyond 50, what it means is that there's a long period where their breast is exposed to estrogen, and that increases the chance of getting a breast cancer. And also ladies who don't give birth early. So it's been shown that if you compare ladies who give birth after 30 years to those who give birth before 18 years, thereabout, those who give birth after 30, their first delivery, I might say, they are at an increased risk. Basically, when you conceive, the estrogen, which is the female hormone, goes down. And then there's another one called progesterone. That's what maintains the pregnancy. So during that period, it's like you have a free period where the breast is not exposed to estrogen. And so it reduces the way the breast cells would multiply. Aside that, it's also mentioned that people who breastfeed, it reduces your risk, because when you are breastfeeding, the estrogen levels are lower. Aside that, it's also been shown, there are some contraceptive pills that have estrogen, which is these female hormones. And so if a lady is on the contraceptive pill for a long time, the one that has estrogen for more than 5 years, it increases the risk of getting breast cancer. But it's also been shown that if the lady stops taking this drug after 5 years, the risk is the same as someone who has never taken the estrogen before. Another important risk factor is genetics, so that if a woman has a relative, most importantly a mother, a sister, or even a daughter having breast cancer, it increases the risk of the person getting breast cancer. It's been shown that there's some gene defects. I don't know how to break down the gene, but there are some defects in the gene that predispose women to getting breast cancer. Yes, so that contributes to just about 5 to 10% of breast cancer. But the majority of them, these are some of the things. Alcohol intake, smoking have all been shown to increase the risk of
breast cancer. Okay. So from what you are saying, although there are a lot of risk factors, the mere fact that you're a woman, you have breasts, it's already a risk factor. So then it means every woman watching is actually at some risk, right?
And every man to some extent.
To some extent, because the men also have breasts, but it's not developed. Okay. Whilst we know these risk factors, generally, what can we do as women, especially in our lifetime, to help reduce our risk? Because we know that ultimately we are at risk. So in our own capacities, what can we do so that in our lifetime the possibility of we getting breast cancer will be reduced?
All right. So there are some of the risk factors that you can control, some that you can't control. So the ones that we can control, basically not taking alcohol intake, checking, smoking. Your weight is actually been shown that if you are overweight, just because you have excess fat, and the fat is sometimes the body converts some of the fats to estrogen. Okay. And so if you are overweight, because you have excess fat, it predisposes you to getting breast cancer. So that if you check your weight as a woman, to some extent it helps. And then you eat healthy as well, eat fruits. It's been shown that too much meat also predisposes, but that's a very small risk. But the most important risk is the genetic ones, okay, which you wouldn't know unless you do genetic.
But here, do we have those things available here, genetic testing?
I think we have a few.
It started, right?
Yes, a few companies that are able to do that.
So then, if you do the genetic testing and it shows that you probably have a mutation to one of those genes, like what are your options?
So then you need to, especially if somebody in your family has it, like your mother, your sister, your daughter, you need to have a conversation with your doctor about it. Because when you have those genetic mutations, it's up to about 16% chance of developing the breast cancer. And so you decide whether you want to. So what are the options? Most of the people, especially in the West, will go for removal of the breast, so that they have that risk. So if they remove their breast, then
so no breast is equal to no breast cancer, right?
Exactly. Okay. It will be very difficult in our setting, but sometimes it has to come to that.
Okay. So let's say right now with like a young lady seeing like some changes in the breast, at what point should I be scared that could this be breast cancer? Because I know that if you have like a lump or any issues with the breast, it's not just breast cancer, especially for the young woman. It could be a lot of other things. Are there any specific things that could point to breast cancer? Or if I see any changes, what do I do? Okay, so
let me start with, so you mentioned that young ladies. So usually breast cancer is very rare before 20 years. And even between 20 and 30 years, it's just about 2% of the people, breast cancer cases that happen. Most of the cases will happen after 30, and it's actually between 40 and 49. That's the peak time where we have breast cancer. So we usually present with a lump in the breast, and it's usually a painless lump, means a lump that is not painful. Usually, a lot of ladies get scared when there is pain. Usually, when there is pain, it's either you have an infection or something. That's not too bad compared to when there is not pain. If you are less than 30 years, most likely you just have a lump which is not a cancer. Yes. In either way, you need to see your doctor, but don't be too scared, especially if you are less than 30 years. So the lump in the breast, which is not painful, some also present with a nipple discharge, so a discharge from the nipple.
But there are lots of people with nipple discharge, right? So like, let's characterize the type of nipple discharge.
So you have a lot of ladies having a nipple discharge just because the nipple is being stimulated. But this one, we're talking of a bloody nipple discharge. You can have a nipple discharge which is creamy even though you are not breastfeeding. Usually those ones are not problem. We don't worry about them. But when there is blood in the discharge, then it's a cause for concern. Exactly. Those are the early signs, and unfortunately in our environment, our ladies don't present early. Now we have awareness, so it's changing a bit, but most people will present when it's very late, and they will come with, when the cancer grows, eventually it can become bigger, and then the skin of the breast will look like an orange peel. And then if you don't, people who delay further, you can develop a sore on the breast. Sometimes you can develop changes in the nipple. So the nipple all of a sudden either turns to one side or even begins to grow inside instead of pointing outside. And then once it grows and overcomes the breast, it begins to spread to other parts of the body. So it can spread to the lungs. So the lungs is what helps us to breathe. Those are the people who present very late, and so you have difficulty in breathing, you have cough. It can spread to the bones of your spine.
So once you get to those points, it means it's really advanced.
Exactly, it means it's really gone far. But at the moment, majority of our patients come to the hospital when it's gotten to that stage, because they will initially go to probably blame it on somebody, seek some spiritual help, apply some herbs to it, and when it's not working, then they come to the hospital, and that's what we are preaching again.
So let's look at this. What are the odds? Let's say I see some changes in my breast. I decide not to go to the hospital. I stay home. I use all sorts of concoctions. How would everything progress till the point of possibly death? I'm asking this because there is sometimes this misconception that people have that once you have breast cancer, eventually you die anyway, whether you come and we do any interventions or not. If you stay at home too, it's the same thing, you're going to die. Like, so what are really the odds? Okay. Why should people still, really report?
All right, so when it comes to cancers, in treating them, the main thing is to get them early. And so if you present early, then the chances of you getting treatment or being cured of the cancer, it's better. And so as soon as you get any changes, you come. But those that delay, what I tell people is that, you are going to die eventually, but if you don't present to the hospital, the death is going to be a very terrible one. You're going to be in pain. You're not going to be able to move around. When it becomes sore, it smells. People can't come close to you. You can't move out. But then if you present to the hospital, and even if it is advanced, there are things that we can do to at least make your life comfortable, for you to be able to mingle with your friends, your family, before eventually, that's what all of us are going to die eventually, whether you get the cancer or you don't. But then the quality of the life that you need.
But then I think it's really important to also mention that, especially for those that are diagnosed very, very early, there are a lot of them around. The survival rate is almost 100% if it's diagnosed very, very early.
Yes.
So I think the main issue is if there are any single changes in the breast, it's important that people report. Not even that. Let's talk about screenings before that point, because one of the things that can help pick up some of these changes is when you are doing your screenings very frequently. So as a surgeon, what's the general advice for women watching in terms of regular screenings? Yeah.
All right. So we advise that once a woman is above 30 years, you do monthly self breast exam. Okay. And so we teach these in the clinics. If you don't, you can go on YouTube. You can get a lot of videos on how to examine.
So when was the last time you had your breast self exam? If you've not had it this year, this month, last month, this is a cue to pause this video, go do it right now before you continue watching this video.
It's very, very necessary. Yeah. So we are advised that when you're doing that, you choose a day in the month. And so we usually don't want you to do it around your menstrual cycle, because during those times, there are some changes in the breast that might not give you an accurate result. So probably a week after the menses is over, you do your self-breast exam. And then luckily, it's now being advertised very well. Every October, there is a breast cancer awareness month. And almost every hospital has a desk that you can walk through and then request to have examined or request to have some sort of investigation done, especially when you have seen a lump in the breast. So the self-breast exam, coming to hospital to get your qualified medical personnel to also do it for you, and then answer any questions that you may have.
How about imaging wise, like breast scans, mammograms as well?
Yes, so those are very important in a diagnosis. So when you notice it or the medical personnel notices it, we're unable to get the details. So we resort to the scans. The scans are able to tell things that we are not able to feel with our hands. The scans will be able to tell. So we do scans. There's a mammogram that we do. Usually when you are in Ghana, when you're less than 40 years, we'll do a scan, because less than 40 years, the breast is more dense. And after 40 years, it's less dense. And so it's better to do the mammogram when you are above 40 years. But when you are below 40 years, we use the ultrasound, which gives us very good imaging of the breast.
So now, after this imaging modalities has, probably picked anything in the breast with a high suspicion of malignancy, what's the next stage for the patient in question?
All right. So we can have imaging. We can all be sure that there is a breast cancer, but until we have taken some of the lump, taken it to the lab for it to be viewed under the microscope, we cannot 100% say it's a cancer. So usually that's the next step. After we've done the imaging, we usually put a pin, a small needle into the lump, take it to the lab for them to confirm that it is a cancer. And the lab also tells us about some characteristics of the cancer that helps us with the management. And then after we've done that and confirmed, then we have a discussion with the treatment options available, the various issues with the treatment, and then together with other breast cancer groups, we help the patient to decide the best path.
Let's discuss the treatment options a little. I mean, some people have complained on some of the options, how some patients are not able to tolerate it and all, and people actually will not present to the hospital because of some of the things that they've heard, especially chemo. Somebody, telling you, I lost all my hair. Someone telling you my skin became dark. Like some of those things, is out then probably pushing people, in not reporting. So, like generally, what are the treatment options? Are they really, really working? And when we look at some of all these side effects, like should patients still really report?
All right. So basically, we have the chemotherapy. So those are the medical treatment, and then we have surgery, and we have some medications that we usually give after surgery. And so everything has a side effects. That's what I usually tell my patients. Why they come to the hospital and they come with some of these concerns. I usually ask them whether they've not heard somebody. I usually ask them, how did they come to the hospital? And they say, okay, they entered a vehicle. And I'm like, okay, so haven't you heard that somebody entered a trotro, a taxi, got an accident and died? They say, oh, they've heard, but you still entered it one and came to the hospital. So the fact that you've heard something about somebody's experience, that doesn't mean that would be your experience. Yeah. The chemotherapy, they are very strong medications because they are killing the cancer cells. But sometimes they are unable to differentiate which is cancer, which is normal cells. So they destroy some of the normal cells. And so you have a lot of complications, not complex side effects. So you lose your hair, your palms will become a bit dark.
But all these things return almost immediately after you are done,
After
right?
you're done, all your hair is going to come back. Your palms are going to look like before. And it's just a little price you pay to live a healthier life and try to overcome the cancer. So that's the chemotherapy. And usually the main thing, the chemotherapy cannot deal with all the cancer. So we usually would give some chemotherapy to bring the cancer cells down. And then you will need, invariably, if you present early, you will need a surgery.
So that's one of the things that people are scared about. Like for women, our breasts mean a lot to us. So the thought of losing my breast is a big deal to me. So are there no other options, like when it comes to, do you always have to take the breast off?
You don't always have to. It's a question of life and death, there's no point holding on to your breast and dying, even though you really need it. If they present very early, there's a possibility of just removing a small area where the cancer is. But then usually if you come late, then the only option you're left with is removing the whole breast. But even that, there are other things that can be done. Together with the plastic surgeons, after the breast has been removed, they can fashion a new breast that when you wear your clothes.
And there are lots of people walking around actually with those reconstructed, but you have no idea.
Exactly. Even some people who do not like the reconstruction, they are what you call miniature breasts that, more like a pad. They put in their pads and then they put on and wear their clothes, and people will not know that you've done something surgery to the breast. So usually we do the surgery, and after the surgery, depending on what the surgery finds, you do either some more chemotherapy or there's what we call the radiotherapy. It's also another way of killing the cancer cells, which your doctor may ask you to go on.
So before we end the discussion on breast cancer, as a surgeon, really, what are your last words to all the women who are watching this particular episode today? when it comes to breast cancer, like what really are your...
Okay, so my last words will be that they should, it's not a death sentence, especially if you present early, and it's something that is common and every woman should be aware of it. We should look out for it. When you're above 30, you should start examining your breast, come into the hospital regularly, especially in October when we have the breast cancer month. And whenever you see any changes, please come to the hospital. You know, sometimes people think doctors or medical personnel, we are not religious, you know. You just come to the hospital, still be doing your prayers with your pastor or whatever your faith tells you. But come to the hospital and back whatever the hospital is going to, the doctors are going to do with your prayers, and then it helps. But don't say, okay, you're just going to pray over it or do some herbal. Eventually, you're going to come to the hospital. But we can help you when you come early. So if you do all those things and come late, we are very limited in what we can do. But when you come early, we're able to help you and you'll be able to live a longer, healthier, and a happier life.
Okay. Thank you so much, Dr. Jefferson, for making time today to join us in discussing breast cancer. With breast cancer, we always say that early diagnosis makes a whole difference in the treatment. So if you are watching us today and you've never had a breast self-exam done, you are more than 40 years, you've never had a mammogram done, you've never had a medic examine your breast, please, after watching this particular episode, go to the nearest hospital and request one done, because it could be a lifesaver. Also, if you have a friend or a sister or an aunt, just tell the person to get those breasts checked or get them screened, because you never know who you are saving. This has been another interesting episode of Ask Your Doctor, brought to you by Jomo Baby and Sonotech Medical Center. See you again next time. It's bye for now.